Welcome, everyone. My name is Jeannie Alter. I'm the Executive Director of the American School Health Association. I'm so pleased to have you with us here today for this webinar. The title of the webinar today is How Public Health Can Collaborate with School Districts to Improve Academic Outcomes by Improving Health. And I think that that gets to the heart of who we are and what we believe in terms of connecting health and learning here at ASHA. So I just want to take a couple of minutes to tell you a little bit about who we are in case ASHA is new to you. And then we'll get on with the presentation. The American School Health Association, or ASHA, ASHA, however you say it is perfect. Our mission is to transform all schools into places where every student learns and thrives. And we encourage the use and implementation of the whole school, whole community, whole child model, or the WSCC model, as you might hear us refer to it. We support this and we do our work to try to transform schools by a variety of things. And these are our benefits of membership. So we are engaged in providing the most recent cutting edge school health research through our Journal of School Health. We also, which all members receive a copy of the Journal of School Health. We also offer continuing education to make sure that everyone is up to date on what's happening in the world of school health. And as we know, in the last couple of years, a lot has changed and changes quickly. So as you're seeing today in this webinar, you'll be receiving some wonderful information from those who are in the field and doing great work. We also offer our annual conference, and we also have self-studies as part of our journal. So you, as a member, can receive free continuing education for all of those things. We also have a variety of discounts available to you. And I think the best part of being a member of ASHA is the network, the information, the expertise, the folks that you can connect with, whether that be one-on-one through our in-person events, which we're excited to return to, connecting through these kinds of events, and also through our bi-weekly newsletter, which is chock full of information and wonderful resources. So please be sure to stay in touch with us, follow us on social media as well. We share a lot of great information there too. Just great ways to connect with your peers in the field. So I'm so thrilled to introduce our two presenters today, Kara Ihedigbo and LaPorcha Carter. And so I'm going to consult my notes so I don't miss any of the wonderful details, but I want to give you a little bit of background into what they do in their professional world. So Kara is the Healthy Living Matters School Health Consultant with Harris County Public Health. And Healthy Living Matters is a collaborative of leaders from different sectors throughout Harris County that are working to address the issue of childhood obesity through policy change initiatives. In her current role, Kara serves as a resource for the School Health Advisory Councils, or SHACs, in each independent school district in Harris County, and a liaison between them and Harris County Public Health as an agency. We also have LaPorcha Carter, who currently serves as the interim director of NCDP. Prior to accepting this role, LaPorcha served as the senior manager of chronic disease prevention under NCDP, with oversight of a number of programming and staff in the areas of chronic disease prevention, ranging from pediatric asthma to diabetes in older adults. She also leads the School Health Leadership Group, a collaborative of school leaders from over 20 school districts in Harris County and the surrounding areas. So I'm so excited to hear from Kara and LaPorcha today, given their extensive backgrounds in this work. And I know that you all have gotten involved in a lot of other things in your work besides what we talked about here. So I invite you to take it away, and thank you so much for being here.
Right, thank you so much, Jeannie, and I apologize. So NCDP stands for Nutrition and Chronic Disease Prevention, and so that's a division at Harris County Public Health, the health department here in Harris County, in which a lot of the activities that we'll be discussing today fall under. So Cara is going to be progressing the slides for me as I speak. So again, we're here today to talk about how public health can collaborate with school districts to improve academic outcomes by improving health. And so thank you guys so much again for attending today. So the objectives, we are going to review strategies to create a healthier school environment for all students by collaborating with local public health agencies and other community members and organizations. And then review how the whole school, whole community, whole child, or WISC model, like Jeannie mentioned, can be incorporated into the districts and school improvement plans to improve outcomes for kids. And then lastly, identify the correlation that exists between healthy students and academic achievement. So just a little bit about Harris County. If you've ever visited Houston, then you know a little bit already. Harris County is huge. I think we need to change it from big, diverse, and complex to huge, diverse, and complex. So as you may know, Harris County is the third most populous county in the country and is home to the fourth largest city, Houston, Texas, in the country. So it's about 4.7 million people here spread over almost 1,800 square miles. And so something that people like to say about Harris County geographically is about the size or a little bit larger than the state of Rhode Island, just our county alone. So talking about kids in Harris County, so there are 21 independent school districts in Harris County, the largest being Houston Independent School District. And there can be anywhere between 4 schools per district or 290 schools, which is Houston ISD in the districts within Harris County. So very diverse, even not just talking about the population, but the school districts and size and, population and whatever that looks like. And then overall, we're serving about 1.3 million kids in Harris County. So our premise here at the health department is LLWWP. So understanding, and you guys may know this in the work that you do already, right? That health is very complex and looks different. And there are many entry points to improving health outcomes in the population. And so we really focus on health where people live, where people learn, so emphasis on today, where people work, where people worship, and where they play. So health takes place in all of those areas. So a little bit about the WISC model, the whole school, whole community, whole child model. Won't spend too much time on this, but just the framework itself and the different domains are community involvement, family engagement, employee wellness, physical environment, social and emotional climate, health education, physical education and physical activity, nutrition, environment and services, health services, counseling, psychological and social services. So this model is really the foundation of all of the school work that we do here in Harris County, especially at the public health department. So understanding that we can marry health and education using the WISC model. So what we know, right? Healthy kids are more ready to learn and have better academic outcomes. And partnerships and collaborations are effective in promoting health in communities. So this is really the driving focus and force behind our continued work in schools in Harris County. If we remember these two things, and that guides all the work that we do for children in schools in Harris County. So basically, healthy kids are better learners. So one of the avenues that we approach school health is through our school health leadership group. And so the school health leadership group at this point has been around, I believe, about 17 years here at the health department. So I like to say that it's ahead of its time in a lot of ways, and it's just gotten better and progressed as the years have moved on. And so basically the 21 school districts that I mentioned, this is a quarterly collaboration and meeting of representatives from each one of those 21 school districts. So it's an opportunity for us to best practice share, for us to have community organizations that are willing and looking to partner with schools and school districts to come and present. So really trying to create a bridge between community organizations and services and the school districts, but then also recognizing that there's an opportunity to build partnership between the school districts in such an avenue as the school health leadership group. So like I mentioned, we have quarterly meetings, and now we have, especially since COVID, we realized the importance and the need to stay in consistent communication with our school leaders, because it became almost impossible. I almost said virtually impossible, but that would have been a terrible pun. But it almost became impossible to really stay connected to them. We would have virtual meetings and it just wasn't the same. And so we send out monthly newsletters so that we can make sure that we are still sharing the best and most recent and current and up-to-date information with our school leaders, and also continue to share opportunities with them as well as, opportunities like today's webinar or something that's going on locally that may benefit both the districts and the children. So that's a little bit about the School of Leadership Group. And these are pictures from our School of Leadership Group meetings and our SHAC meetings, which Cara will talk a little bit about later. So like I mentioned, these meetings, they look very different every time. So the picture above, that was a Tai Chi demonstration that one of our former staff members was leading. So everybody got a break and, found their Zen and came back to the rest of the meeting. And this bottom picture, we actually were doing a community health assessment and really wanted to get the input of the school sector. And so that was a really great opportunity to get the expertise and the knowledge from the school leaders, because who better else to give us information and input regarding schools and children in Harris County. So the School Health Leadership Group, from that was birthed two different groups. So the Houston Health and PE Leadership Group, and then the Greater Houston Kinesthetic Classroom Collaborative were birthed from the School Health Leadership Group. So like I mentioned, there has been the opportunity for these districts and school leaders to meet and, work through ways that they can better partner or fill a gap in the school district system in Harris County. And so from that, this is an example of that these two groups were birthed out of the School Health Leadership Group. And Healthy Living Matters, Cara, I think this is where you take over from me, if I'm not mistaken, because Cara leads Healthy Living Matters. So we will switch off.
Hey, hi everyone. Yes. So my name is Cara Ihedigbo, and I work for the Healthy Living Matters Collaborative. So that was a collaborative that was founded in 2011 to address the childhood obesity issue that we do have in Harris County. About 1 in 3, what's the next slide? 1 in 3 kids in Harris County are considered overweight or obese. So Healthy Living Matters is just a collaborative effort to address that through policy change. So giving families and communities more access to be able to make better decisions for themselves. And so all of the policy initiatives that we promote are focused on eat, play, or learn initiatives. So promoting health education, promoting physical activity, and of course, good nutrition and access to good nutrition. And it's a multi-sector group made up of different leaders from all over the community. So there's the school sector, of course, is represented, early care and education, parks, and the clinical side, so pediatricians and nurses. It's really a multi-sector collaborative, and it's been a great experience. So a little bit about obesity in Harris County, or I'm sorry, in the state of Texas. As you can see, this is information from the Michael and Susan Dell Center for Healthy Living. And you see that obesity in Texas is an issue in general. We have the 19th highest rate of obesity for the ages of 10 to 17, and then the 10th highest for adults. We know that it's expensive. Obesity is expensive because it leads to chronic illness in the future and does put a strain on the system. And then you think about now with COVID-19, unfortunately, those who contracted COVID-19 and had not great outcomes, and mortality rates are definitely higher among populations that are obese. And this actually goes the same for the pediatric population as well. Different physicians that we've spoke to in this community have said that those who are in the ICU, a lot of them who are teenagers, are actually kids who are obese. So it's definitely something that we want to address in our community. You know, it's an American issue, but this is what we're doing here in Texas. So I talked some about this, the cost of obesity and childhood obesity on the system, and what we're doing to combat that. So as was mentioned, the slides will be available. So these links are active links, and feel free to use them as resources as you see fit, so that this information, as I said, comes from Michael and Susan Dell Center for Healthy Living. And I did mention that 1 in 3 kids in Harris County are considered overweight and obese. So one of the strategies that Healthy Living Matters has to impact the different policy changes is to have me liaison with the school health advisory councils. So in Texas, each independent school district is required to have a school health advisory council, which is called a SHAC. And this body is made up of parents, school district staff, and different community members interested in school health. And they make recommendations to school boards about different school health policies around any topics and curriculum that's related to health. So it could be nutrition and physical activity related, health education, recess, sexual health education, and then more recently, there's been a focus on having the SHACs review curriculum related to mental health and opioid education. And I know as far as on the federal level, it's a requirement for school districts who have national school lunch and or the school breakfast program participation, that you have to have a wellness plan for your school district and to have it reviewed by stakeholders within your school community. So the SHAC also serves as this board usually in the state of Texas. So just as something so we can gain little information from you all, if you don't mind just sharing for your state or for your area, who is the body that reviews, creates your wellness plans and reviews them for your districts? If you just want to put that in the chat and we can just take a look at that later. That was just out of our own curiosity to know. I think some states do have SHACs, but I don't think it's, a nationwide thing. So please share. So as we mentioned, Healthy Living Matters, which is a program out of Harris County Public Health, really focuses on promoting movement and good nutrition within schools and for kids. So we know from research, there's evidence that says that physical activity is correlated with higher cognitive function. And data shows that there's fewer discipline referrals. We even have that information anecdotally from different school districts in our area that have implemented some action-based learning strategies into their instruction, that they've had fewer discipline referrals and kids sent to the office and things like that. We know that a healthy diet improves cognition. And then research also shows that kids who are regularly active get better grades. And breakfast programs are also associated with higher grades. And some of this information can be found for Action for Healthy Kids. This link right here, which you'll have access to if you reference the slides later, is a learning connection document that they put together that can be used as a point of education for your school leaders, principals, anyone that may be interested in creating more of a culture of health on their campuses without taking away from grades. It definitely is a great way to just educate them and make that connection. And the Texas chapter for Action for Healthy Kids has been a great community partner to us at Harris County Public Health, and especially to the school districts in our area as well. So you think this is a slide which I love because it just really highlights and makes it clear how much of an impact physical activity and just movement can have on our brain activity. So you see the brain on the left, my left, is what a brain looks like after sitting for about 20 minutes quietly. And then the one on the right shows what a brain looks like after walking for 20 minutes. So you think about for yourself, which brain would you want to learn with? And which brain would you want to take a test with or be assessed with? For me, I would want the brain on the right that's active and ready to go. So that is something that we promote. One of the reasons why we strongly promote, more opportunities for having activity in the classroom, physical activity in the classroom. This is an example of just a partnership that we had with one of our local school districts here in the city of Pasadena, which is a city that is right outside the city of Houston. And Healthy Living Matters has had a close relationship with Pasadena for the past couple of years and was actually instrumental and one of the key partners in assisting with the creation of Pasadena's Safe Routes to School plan that the city now has on file. And so, Healthy Living Matters helped to host, co-host walk to school days and bike to school day events with different schools in this district. And is now, it really has become a culture of the school district so that they are now, hosting their own walk to school day events, their own bike to school day events without any, support or input from us as partners. It's just become a part of their school community culture, which is great to see because you go back to thinking about what the brain looks like. So these kids that are walking, they're ready when they get to school to learn. Their brain is awake and ready to go. Additionally, having a focus on social emotional health and learning has shown to be very important and beneficial to the health of students as we think about the whole child. It helps with their social awareness, responsible decision making, self-management, but also some of the outcomes are, again, fewer discipline referrals, higher grades, and a better attitude towards school and learning. So that's something else that we promote, and our Nutrition and Chronic Disease Prevention Division is doing more with that as well in recent months. So some opportunities for school leaders to help create that culture of change in campuses and in districts is to support some innovative instructional delivery. So examples of that could be action-based learning in core classes. So that might be just incorporating physical activity, incorporating movement into reinforcing the content of a certain, area of study, whether that be math, grammar. You can be creative. And it's shown to be very effective in having kids remember, retain information. And then they're also getting that physical activity, increased brain function. It's good all around. Also, alternative seating options is something that you can consider because kids learn in all different ways. And some kids do need just a change of pace, or having alternative seating can just have them be able to focus on instruction from the teacher. Another example is green schoolyards, something that Healthy Living Matters promotes in our policy priorities is having kids get outside. Research shows that kids going outside is beneficial to their health, as well as their mental health. So thinking about outdoor classroom spaces where kids are getting outside, getting movement, but they're also having the opportunity to get content reinforced to them. So it's not taking away from instructional minutes. And then having that integrated, those integrated SEL programs as well. And of course, as we mentioned before, prioritizing the walking and biking to school. This is just an example of what an action-based learning lab might look like. We have some districts in our area that have incorporated action-based learning. Some have labs, some just do it within the regular classrooms by a regular classroom teacher. And there's also funding that's available for things like this. So if this is of interest to you, if you want to try incorporating action-based learning in your curriculum, if you want to get some of this kinesthetic tools, there's funding available. So don't let that stop you from even just thinking about it. Because there are people that want to see this happen. So it's something that we definitely promote, and it's just great to see the kids really enjoy it. And again, you see it in their academic performance as well. And here's an example of green schoolyards. And you could just Google Green Schoolyards America and get more examples of this, but yes, sharing that photo. And then we really encourage leaders to support the priorities of SHAC. So I mentioned that's what we call our body here in the state of Texas. But whatever you call your wellness team or whoever reviews your wellness plans in your state, they can really view them as an asset to your school community. Because if they're only reviewing the wellness plan, there's other opportunities for them to really get input. Having a body of parents and school staff and supportive community members could be a great asset to your school community to really do some great things and really create that culture of health that you're striving for. And it doesn't have to take away from academic outcomes. It can enhance it. We also, in addition to, advocating for health promoting policies within our local school districts, we also do that at the state level through Healthy Living Matters and other collaborations. So an example is supporting recess for all students, supporting policy priorities that promote access to healthy food, supporting a robust physical education instruction. So having trained physical education teachers and not like the librarian teaching PE. And then advocating for health education for all students. And that is something that in our state, health education is actually not a priority for, or not a requirement for graduation in this state. So that is something that we continue to advocate for. And then consider in your area joining a statewide coalition that focuses on child health. So here in Texas, Healthy Living Matters is a part of a group called the Partnership for Healthy Texas, which advocates for reducing childhood obesity in the state of Texas, but also child health in general in the state of Texas. And it's a group of many different organizations throughout the state with this one goal of impacting child health through policy. And then in thinking about the WISC model, it's really an opportunity to encourage campuses and different district leaders to really utilize the model in thinking about how to improve campuses. So as you do your campus improvement plans or whatever you might call it in your area, it's an opportunity to think about the WISC model and how to implement. So you've done your assessment, you know, like areas or gaps that you want to fill. Think about the WISC model and just that implementation. Because you want to impact the whole child, so this is a great way to do that, having all of the stakeholders on board. Thinking about COVID-19, which we are all still in the COVID-19 experience. So it's shown, the WISC model was shown to be very important and an important tool for schools. If it wasn't important in the past, going through this experience has shown how important it is now to have all stakeholders on board. Everyone involved in the school community had to be on board, has to be on board and in the know about what the school culture is, what the policies and procedures are around COVID-19. But it's just an opportunity or an example to show how to get the best outcomes and to have students be as healthy, safe, challenged, supported, and engaged as possible while they're on your campuses, that it's best to have all these stakeholders on board and knowing that mission. So just an example of a group that might be more in the conversation now that wasn't prior to COVID-19 is the physical environment, which we know that those conversations are ongoing about how is the school set up, what is the air quality, water fountains, janitorial service, things like that can be brought more into the discussion of health in general of students on your campuses. And we actually last month had the opportunity to share a poster at the ASHA conference that just happened in July about some of our interaction with schools during COVID-19 and how it evolved and how it changed and how we worked together to get through this, and we are still working together to get through it, and we will get through it for sure. So this is just some of the examples of our collaboration that we did have during COVID-19. As LaPorcha mentioned, we had the school health leadership group meetings in person, and it was a great experience to be able to meet with these school leaders 4 times a year. And so we still kept that engagement, but we pivoted to virtual meetings. We still did brain breaks and activity breaks to reinforce those things that we promote during our meetings, even though it was virtual. But in addition to that, we also had school campuses and properties that they collaborated with Harris County Public Health to serve as testing sites. And then when the vaccine became available at the end of 2020, they quickly, were able to offer their properties and campuses as mass vaccination sites as well, to be able to start that process of getting the community vaccinated and quickly. So we were able to quickly pivot and use those properties for that purpose, which was great. And additionally, from some of the feedback that we got from the school health leadership group, from our previous interaction and relationships with school partners, we were able to find out what their questions were about going back to school. We were able to address some of their concerns in our school reopening plans. And then we also hosted town hall meetings with school districts, which was an opportunity for them students, not so much students, but it was an opportunity for staff and parents to ask questions about COVID-19 in general, about mitigation strategies, etc., and an opportunity for them to ask questions from trained and experienced epidemiologists and physicians and experienced public health professionals who could answer their questions with evidence and facts. So that showed to be very important during this time. And this is just some pictures of the example of one of the vaccination sites, and then also the COVID outreach team that provided that continues to provide information to the community about different resources available, testing, mask wearing, busting some of the myths and things like that, and also providing masks to the community. And that's just an example of them handing them out while kids are getting on the bus. So that is primarily what we wanted to share, and just encourage you all to collaborate with public health in reaching your goals and having a healthy school community and campus. And we're happy to answer any questions that you guys have.
Thank you, Cara and LaPorcha. That's wonderful. And I really enjoyed your pictures and kind of seeing those things in action. We do have some questions, so I'm gonna read some of those off from the chat box. I also see somebody has their hand raised, and I have a question or two as well. So I'm glad that we have some time to be able to talk with you some more. So Elizabeth wanted to know who represents the schools on the leadership groups. Is it superintendents, principals, school nurse leaders? What is the typical? Who are the typical players on those leadership groups?
Yeah, so we have not superintendents. So we meet with the superintendent separately, and that actually developed as a result of COVID-19, having to pull together all the superintendents of the various school districts in Harris County. But you have school nurses, district nurse leaders. A lot of districts have folks that are designated to oversee school health, district health, and health activities. And so it's a variety of folks on, you have SHAC leaders and SHAC directors. So you have a variety of folks that participate in the school health leadership group on behalf of the districts. We leave it up to the school districts to volunteer who they would like to volunteer. There's a lot of folks that are in charge of the physical activity for the district that participate in the school health leadership group. So it varies from district to district. We just ask for school health leaders and they send us, or district health leaders, and they send us who those representatives are. So we don't limit it or restrict it in any way.
Wonderful. And on one of your slides, you mentioned in reference to the WSCC model that it helps kind of bring people to the table that you might not typically involve. Do you have any examples of kind of those atypical people? I don't know, that sounds silly, but people that you wouldn't typically think would be there. Do you have any examples of those folks that are represented on your SHACs?
Well, on the SHACs, or folks that we have come into the school health leadership group to partner with the district? Any
and all of it.
Okay.
Yeah.
Okay, Cara, feel free to contribute. One that I can think of that we've partnered with quite a bit is our local university, so the University of Texas School of Public Health. So they have developed a lot of programs for schools. A lot of research has gone into the program development, and so we've given them the stage and the opportunity to present to the districts and partner with them. We've had teen and dating violence programs come. We've had the census representatives from the census come and talk about the importance of filling out the census and what that means for school funding. Oh my gosh, we've had so many folks over the last 17 years. I'm really trying to think of some of the most unique ones. We've had Texas A&M, who their Department of Agriculture does a lot of nutrition and education programs. They've come out to speak and to partner. Substance abuse, opioids, as you know, has been on the rise, and vaping. And so we have a lot of resources and programs in Harris County that can partner with the school to do some substance abuse prevention and treatment and referrals in the schools and in the districts. So really following that WSCC model and really identifying partners in the community who can truly engage with the school districts in better health outcomes for students. And in our upcoming school health leadership group meeting, we have a representative from a local nonprofit who does a lot of work around immigrant children and immigrant health. And so talking about, hey, in your school districts, right, like it looks a little bit different for this group of kids, and this is how you can best serve them. These are best practices. So it just really varies. Each meeting, we try to have a theme with the partners that we involve and engage. But yeah, we definitely use the WISC model as the foundation and understanding, okay, making sure that we're touching every single one of these domains in our meetings and providing resources to the school districts that they may not even know that they need or recognize the true need of it. And so we really try to follow the model with doing that. Cara, do you have anything else to add? Sorry, I tried to think of some partners on the spot, but I can definitely send you a more in-depth list too of folks that we've had come if you guys are interested.
Yeah, I would say as far as the SHAC side, I can't off the top of my head think of any new partner that I saw at the table at a SHAC specifically, but I would say that having updates at the SHAC meetings from partners maybe who, or on topics maybe that they would not necessarily update on, such as the physical environment, about cleaning and things like that, what was being used to clean, those types of conversations prior to COVID-19, I never heard discussed. But then I know that in individual school districts, reopening plans and COVID-19 policy and procedures, and maybe the school districts have like task forces, COVID task forces, and those that deal with the physical environment were a part of those. And prior to that, and it wasn't necessarily the case to have them all be involved together. So that's what I can add for that question.
Yeah, that's great. And I think one of the strengths of the WISC model is just that encouragement of working together and finding common ground. I know in a former life, I did more community-based work around substance use. And I think, we saw some unusual partners like realtors or people in the insurance industry who have a stake in things like, homes where there was a meth lab is very, is hard on the property value. And smoking and fires and things like that. So finding that common ground, I think, is really helpful and important, because usually you're working toward the same goal, though your vested interest might be a little different. So I think that the WISC model kind of helps us remember that. So thank you for those examples. Another question that we had, and I'll kind of combine two here, is in your school health plans, do you see the incorporation of the importance of vision and, oh gosh, what was the other one? Holy moly. Vision, and the other one, was oral health. Sorry, I was like, it's so. So do you see the incorporation of those two elements as well in your school health plans, in your experience?
Yes, I would say for sure. I know in Harris County Public Health, we do have an oral program, a dental program for kids that they go out to the schools and they're able to provide services right on school campuses. And then there's also, an education component that goes along with that. So we are able to provide that service. And there are other partners in the community also that do provide that service. And as far as eyes, I don't believe Harris County Public Health does anything with eyes specifically, but there are community partners that do have vision screening and different partnerships for kids to be able to get glasses if that's a need. And that is something that is discussed in SHACs as different resources. That's a place where they present that information. Do you have anything to add, Portia?
No, I think that's perfect. I was going to say, as the public health department, that's our role, right? To be the convener, but then also to be the connector to community resources.
Yeah, so important to involve the community. Yeah. Kate asked, how have you engaged students with the school health leadership group, SHAC, or other similar groups?
Yeah, so Cara, I actually let you take this one away. So we don't have youth involvement with the school health leadership group specifically because that one is designed for, it's like a think tank for district health leaders, but we do involve students in the SHAC and in Healthy Living Matters. So I will let Cara take that one.
Okay, sorry. Trouble unmuting. Yes, so there are some SHACs that have students that are a part of their SHAC, which is great to have that student input. And there are some that are working towards that. And as far as Healthy Living Matters goes, we have a youth component. So we have a youth advocacy program. And so in the past, we've had students go to the Capitol and advocate for health policy. Specifically, when we went in 2019, they were advocating for recess because there is no recess is not a given in the state of Texas. So there's some districts that have a robust recess program and then some that kids might not get recess. So just to streamline that and have all kids in the state have recess, that is something that the youth advocates associated with Healthy Living Matters were able to go and talk to lawmakers about. And so we are continuing with that program. It sort of pivoted, due to COVID-19, the phrase of the year. We were not able to have students really engage in that same way in person during the 2021 legislative session, but we were able to have them meet with a state representative on Zoom. So we do have that opportunity. And then going forward, Healthy Living Matters does plan to have more of a robust youth engagement to be able to have youth advocate more on the local level for their health and communities. And not just at the state level. So they're able to, be more involved with their school health advisory councils, as well as talk to local elected officials.
That's terrific. I feel like maybe one of the silver linings is that, we have a bit more access to our legislators. But because everyone's gotten more comfortable with Zoom, and I think that they really like to hear from our young people, and they can be very impactful in sort of delivering those messages. So that's wonderful to hear. Let's see, Elizabeth asked, with the increased need for social and emotional learning support for students in the return to school this year, what supports has the health department offered to schools?
Yeah, so that's a really great question. So a couple of things. As I mentioned earlier, we have the School Health Leadership Group newsletter that we send out, resources and opportunities for students in that, a lot of them related to SEL. Number two, we have a mental health program. And so our mental health team has come and spoken to our school health leaders and let them know that we are a resource to provide trainings, et cetera. And then also Harris County is very blessed to have a school behavioral, I'm gonna mess this acronym up. It's the School Behavioral Health Coalition. It's operated under our Mental Health of America, like our local Mental Health America chapter. And all they focus on is mental health, social emotional learning, and everything for schools. And so that is a resource that's available to our school districts. And similar to the School Health Leadership Group, there are a lot of us district leaders that participate in that coalition as well. And we also refer and partner as well with that group.
Terrific. Yeah, I know that's top of mind for everyone right now. Tamara asks, what suggestions would you give someone who doesn't have a school leadership team and would like to start one?
Sure. I would say from the school perspective, if you are a school staff person, I would say it does not hurt to contact your local health department, especially if there's like, you may not know if there is a specific school program, but there may be a child health program or something. Like every health department typically has programs targeting child health. And so just having a conversation about the need or the desire to start some type of program partnering with schools, and we are happy to assist in those conversations and be a part of the conversation. So from that perspective, if you're a school staff person, I would say just approach your local health department and say, hey, this is something that we are looking to do. This is for like the school health leadership group. I think I'm understanding the question correctly. And then if you are already a member of a local health department, you know, I can only speak how it will work here, you know, like bring the data and say, look, we need to be working with schools. We need to be working on behalf of children in this way. There's an opportunity here that is truly being missed, and then use examples of best practices in the different communities that are working. And again, I offer to partner with you guys and have a conversation. We will leave our contact information in the chat if you want to talk more about how we operate. But I think those are the two ways that I would suggest on behalf of a school person or someone that works at the local health department. Again, ours has been around for 17 years, but it has evolved a lot. And a lot of that evolution comes from just having those conversations, right? Like they're hard sometimes and it seems impossible. Like, I don't know who's gonna, you know, give buy-in to this, but you won't know until you try. You'd be surprised by using the WISC model, using best practices, using community examples, you know, just for advocating for the need for a school leadership team. I think that's probably the best way to go.
Terrific. And what are some of the challenges that you've had in terms of engagement of those leaders in that in the leadership group?
I honestly can say, and I'm not saying it's perfect, but let's talk pre-COVID. I would say pre-COVID, you know, we were blessed because we built a rapport with the district leaders and the schools for so long. We built a rapport, and so the engagement was easy. I think we invested the time to build that trust. And so when that trust was built, it was just easier for us to facilitate the conversations, and they trusted community partners that we would bring in to speak with them. We would vet the community partners for sure. And, you know, all community partners kind of go through us as the gatekeepers to get to the school districts in this area, in this arena. So I think that pre-COVID, the trust was there already, thankfully, to successfully engage the school districts. Now, that's not every school district. There's 21 of them. You know, you have some that are more engaged than others by far. But we are relentless in reaching out. I will not lie about that. We are relentless in reaching out and really trying to engage them and work on behalf of the kids in Harris County. Now, post-COVID looks a lot different, you know, because for various reasons, right? COVID has been so politicized, and then, you know, the education agency may be saying one thing, and then you have the federal government saying this thing, and then you have all of these different recommendations. And so it got really difficult when then on top of that, now the health department is stepping in and trying to give recommendations as well and guidance. And so again, it took a lot of conversations. Those are the challenges that we had, especially with COVID, is just honestly a lot of information coming at the school leaders at one time, and we just had to build that trust and have a lot of conversations. Like, this is the guidance, this is where we pulled it from, this is evidence-based, you know, like we've never seen this before, but we know this is what works with other viruses. Like, you know, just really having a lot of conversations. So I think a lot of the challenges, if I'm being completely honest, came post-COVID. But before then, I just think, as always, you're always going to have some folks that are just not as responsive or as engaged as others. And the way around that is just, I will pop up on you. Well, we can have like an in-person visit, or, you know, just continue to reach out and try to engage in trying multiple avenues for sure.
Oh, LaPorcha, I pre-COVID was a big fan of the pop-in.
Yeah.
So, yes, I get it.
Yeah.
So as Louise points out, you know, some don't have a local health department. Does your Department of Health have provide any resources or assistance to the schools?
We don't. Is the question if we could provide services to schools outside of Harris County?
Well, meaning does your state Department of Health provide resources that in the event that an area doesn't have a local health department?
No.
How about in your experience?
No, I was like, I'm not gonna even, I was gonna try to like think of a way to like sugarcoat it, make it better. No, I think, we do have the Texas Education Agency and they provide guidance and, but outside of Harris County Public Health and the local health department, I think we've just been so intentional with school health. I think the state health department, their function really isn't to do local public health work, unfortunately, right? Like they can give general school guidance and general health guidance, but their mission is not the same, if I'm being honest. And so we have the mission of serving the local community, kids included, schools included. So if I'm being honest, personally, state Texas, the answer is not really, but mainly because their charge is just different.
Yeah, great point. Cara,
I'll just add, I'll just add, I think that if your local, you don't have a local public health agency, whatever organization in your state, is the overseer for health, I think that if you do approach them and show interest to say, we have all these kids that we are responsible for from August to June or whenever, from 7 to 3, 4 o'clock, and that you want to do something, I think that you approach them from that standpoint, that they might be willing to partner, interested in partnering, or maybe they don't even know that there's an interest. And then additionally, I would say that I think someone put in the chat Alliance for Healthier Generation that has resources. So just to say, like, there are other organizations, nationwide organizations, and there might be local organizations in your community that do have a focus on school health, child health, and that do promote best practices within school campuses that you could reach out to provide some like technical assistance and maybe even help in having those conversations with like a state agency or someone that might be able to start something new. You never know what you can spark and change. So I encourage you to do that, whoever asked that question.
Yeah, no, I think that's a good point, Cara. The local health department or the state health department doesn't have to be the anchor of a group like this. There are a lot of community organizations that prioritize and focus on school and child health. That's a really good point.
Yeah. A lot of really great questions today. I know I saw a hand earlier from Mary, and I don't know if Mary had to drop off. Okay, well, hopefully she had an opportunity to put it in the chat. I appreciate all of your really great questions. I appreciate your attention. And I really appreciate, Cara and LaPorcha, your wonderful example of the work that you're doing, and really appreciate you being here. I want to take just another moment to remind you all about our, let me catch up here, folks. Continuing education. So for those of you who are health education specialists, we're offering 1 hour through NCHEC. For nurses, we have 1 NAP contact hour. And if you need to provide a continuing education to your employer, or if you want to submit it to a different certifying body, we can also offer you just a participation certificate. Those are free to our members, but are available for a small fee if you are not a member, but you should consider being a member. I mean, come on. So there is, I believe in the chat box, there's a link to the evaluation. You'll also get that in your email following the webinar. Just want to let you know of some upcoming webinars. If this was helpful for you, please check out these, as well as we have all the others archived so you can watch those. And please spread the word of our upcoming webinars. We appreciate your participation today, and we appreciate you, Cara and LaPorcha, for your time and wonderful information. Thank you so much. And you all stay safe and have a great rest of your week. Thanks all.
Thank you.
Thank you so much.